Graft versus host disease, or GVHD for short, is a type of pathology associated with organ transplant. In GVHD, donor T cells attack an immunocompromised host. In this video, I'll share my visual mnemonic to help you remember all the information about GVHD so you'll be ready for test day. Welcome to my orchard. I've been trying to place some new grafts on this tree. If you've ever gardened before, you probably know that grafting trees is a really common method to get different plants to grow on a single host. The practice is actually pretty crude. We just wedge these graft plants into the host. By the way, these plant grafts coincidentally help me remember graft versus host disease, or GVHD. I just really wanted to peg the word graft here, since the other transplant pathologies are all about a timeline of rejection. Graft versus host disease is the only one with graft in the name. GVHD is exactly what the name suggests. After receiving an organ transplant, or graft, cells from the graft will attack the host, causing damage. Let's talk about how this happens in detail. Pay attention to the tomahawk I'm using here. I'm using this tomahawk to cut into the host tree, creating wedges for the grafts to grow into. By the way, this tomahawk cutting into the host plant represents T cells attacking the host, since the tomahawk is a recurring symbol for T cells, right? Tomahawk starts with the letter T, and tomahawks are used for direct close-range combat, similar to how T cells function using direct contact. And we're cutting into the host plant to peg how grafted T cells attack the host in GVHD. Let me explain how this happens. When we transplant an organ, the organ still contains all its cells, including T cells. T cells are trained to recognize anything foreign, and they'll recognize the new host as foreign. As a result, they will attack the host cells. Since GVHD involves T cell-mediated damage, it's also an example of a type 4 hypersensitivity reaction. You know, the cell-mediated delayed type reaction mediated by T cells. Just remember me using my tomahawk on the host tree to remember that GVHD is caused by graft T cell attack of the host. To learn another important part of GVHD, take a look at my cane here. You know, since gardeners like me are usually old people, right? And old people use canes to help them get around. Coincidentally, this cane is actually our recurring symbol for immunosuppression. Since immunosuppression describes a weakened immune system, and a cane is used when someone is too weak to walk, we're using a cane to represent immunosuppression. You got it? This immunosuppression is actually critical to the pathogenesis of GVHD. We know that GVHD is caused by graft T cells attacking the host. In a normal immune system, this would not happen, as the host's own immune cells would be able to overwhelm the donor T cells before they could even get a chance to get sensitized to host antigens. However, remember that most transplant patients also happen to be on immunosuppressive drugs. They do this to prevent transplant rejection, of course. Unfortunately, it's exactly this induced immunosuppression that gives donor T cells the chance to attack the host. In reality, immunosuppression is carefully managed to minimize transplant rejection while preventing GVHD. These complexities are way beyond the scope of this video, so just remember this cane to remember that GVHD happens in immunocompromised patients. Now that we've covered the pathogenesis of GVHD, let's talk about some cases where it's seen. See this bag of bone meal I'm using as a fertilizer? Bone meal actually is a fertilizer. Trust me on this one. But the bone meal here has a different purpose. It symbolizes the bone marrow. That is, bone marrow transplants. And all of this is here because GVHD can happen after bone marrow transplants. You already know that GVHD is mediated by T cells, and that T cells originate from the bone marrow. So it makes sense that bone marrow transplants confer a higher risk of GVHD, since transplanted bone marrows contain more donor T cells. This is kind of easy to understand, so I'm going to move on. Next, take a look at my shovel over here. Obviously, a shovel is a must-have tool for gardening. But notice specifically how this shovel looks like a liver. Yeah, it's got the same triangular shape and even that crease in the middle between lobes. This liver-shaped shovel is actually our symbol for the liver. Another common transplant that usually results in GVHD is a liver transplant. This is because the liver also contains lots of lymphocytes, and more donor T cells means more GVHD. Make sense? Now that we've covered all the causes of GVHD, Let's talk about the clinical presentation. For that, just take a look at my pants. Yeah, I know it looks bad. I promise it's just mud. Gardening is very messy work after all, right? These muddy pants are actually our symbol for diarrhea. Since the muddy pants here kind of look like diarrhea. The pathogenesis of diarrhea is obvious. Donor T cells attack enterocytes and other cells lining our GI tract, leading to inflammatory diarrhea. Other signs that may go with diarrhea include abdominal pain and GI bleeding. Next, turn to the red wrapping I use to make sure my grafts stick. If you're familiar with grafting, you'll know that new grafts need to be wrapped to ensure the graft attaches to the host plant. Well, this wrapping is red, which kind of reminds me of red skin. Like a rash. Since rashes are red and appear on the skin, which is the covering to our body, we're using a red wrap to symbolize rashes. Developing skin rashes is another symptom of GVHD, which occurs when the donor T cells attack cells in the skin. Okay, for the final hallmark symptom of GVHD, we're going to turn back to our liver-shaped shovel. On top of reminding us that GVHD is common in liver transplants, this liver-shaped shovel is a double peg for jaundice and hepatomegaly. Long story short, the grafted T cells can also attack the host's liver, resulting in jaundice and hepatomegaly. Liver injury is yet another symptom of GVHD that you should know for test day. Before we move on, I want to mention a high-yield clinical pearl. You may have noticed that multiple host organs are affected in GVHD. This is as opposed to the other types of transplant rejections, where it's usually just only the donated organ that's affected. This should make sense, since the other rejection syndromes describe situations in which the host's immune system wins against the graft, resulting in graft pathology. However, in GVHD, the graft's T cells win against the host. And the host is, it's like the whole body. So symptoms are widespread, involving the GI tract, the liver, and the skin most commonly, although other organs like the lung can also be affected. Finally, take note of where I'm trying to put this next graft. Yep, it's inside the giant tree knot. All trees have these weird bumps and knots, right? Well, this knot actually reminds me of a tumor. Since it's a large growth that kind of looks like a tree tumor. Next, notice how my tomahawk is literally cutting into this knot. In other words, I'm attacking this knot. This should help you remember the graft versus tumor effect, positive effect of graft versus host disease. This is usually seen in cancer patients that get bone marrow transplants. Basically, the graft T cells attack the host tumor cells, which can help treat cancer and induce remission. Pretty neat, huh? Alright, that's it for GVHD. Let's recap quickly and get out of this garden. Graft versus host disease, or GVHD, is a pathology that can occur after organ transplant. GVHD occurs when donor or grafted T cells attack the cells of an immunocompromised host, causing widespread damage. GVHD is commonly seen after bone marrow and liver transplants, since these organs contain high numbers of T lymphocytes. The typical presentation of GVHD includes rash, diarrhea, jaundice, hepatosplenomegaly, among other findings. Although GVHD is usually bad, it can be potentially beneficial due to a graft versus tumor effect in which grafted T cells attack tumor cells inside a host to treat cancer. Okay, and we're done with GVHD. That one wasn't so bad, right? I'll see you in the next one.